Osteokinematics of the hip.
Okay, there's also considerations with orthokinematics of the hip that we have to take into play. In the normal long axis of the hip, this is basically what we're looking at with Darren's left leg. So when the patient goes into hip abduction, this is what it looks like in terms of the orthokinematics. The hip is going into an inferior glide. Okay? When the patient crosses over into hip adduction, adduction, the hip is going into an adduction position, but orthokinematically, we're going into a superior glide with the femoral head. When the hip goes into when the hip goes into external rotation, you can see where the hip orthokinematics are going into an anterior or external rotation, goes anteriorly into the capsule. When he goes into internal rotation along axis, it takes in a posterior glide. A posterior glide. Also with flexion, you notice that the hip just kind of rolls. He stays in place, but he's just rolling. Same with extension. He kind of rolls back. There's some glide involved, but it's mostly this roll component. So now we're going to show you what happens to the hip once the knee or the hip is placed in 90 degrees of flexion. So we're going to have the patient lay down into supine. And we're going to bring his leg and hip up into 90 degrees of hip flexion. So essentially, this is what we're doing. This is what we're looking at. Okay? So now, when the patient goes and performs hip abduction in a 90 degrees of flexion, we're basically seeing this take place, an anterior glide of the femur, of the head of the femur, anterior glide. When the patient goes into hip adduction at 90 degrees of hip flexion, we see a posterior glide of the head of the femur, a posterior glide. When this patient goes into external rotation, we see a superior glide take place at the head of the femur, a superior glide. When this patient goes into internal rotation at 90 degrees of flexion, we see an inferior glide take place at the head of the femur. So the question is asking, what can we do when we're at flexion at 90 degrees when a patient is having difficulty with hip abduction? In this position, he's doing an inferior glide. I can move him up into hip 90 degrees, and I can do what? I can take him into internal rotation and get that component of inferior glide from this position. Patients having difficulty getting into hip adduction, that's a superior glide, orthokinematically and long axis. I can take them up into hip flexion, and I can do an external rotation at 90 degrees. That will take care of the problem that's taking place of the patient that's having trouble with hip adduction. If the patient is having a problem in, let's say that the patient's having trouble with, I got lost here. Which one? Oh, external rotation. External rotation is going to be an anterior glide of this hip. So I can take him up to 90 degrees of hip flexion and abduct at 90 degrees. That works the anterior capsule with the head of the femur. Patient has trouble with internal rotation. That's a posterior glide in long axis. I can take the patient up at 90 degrees of hip flexion and adduct that patient. That's also doing a posterior glide. Just some considerations to take place orthokinematically versus osteokinematics.